Now let's go to Master Tung Acupuncture. We will review T11.02, Xiaojian. Okay, number one, what is the exact depth range for needling Xiaojian when treating lung diseases?
0.1 to 0.2 soon.
Yes. In the case history, which acupuncture point was first to use to drain and make space in the lungs for clear qi?
Chuchi.
Okay, Ella.
Lang,
I memorized nyo. Okay, Ella. Chinese. Okay. The
I.
term.
For ano yun eh.
Mm-mm.
Good for clearing heat. Diba?
Oo nga, ipaturo ko nga si Sister Rosa sa ano, no? Parang,
For heat yan, parang command point siya.
Ella 11. Oo.
All,
Pang drain.
yung, pang drain ng
Maiinit. Para
exit.
hindi pag-fever ng matagal. The term Xiaotian literally translates to which of the following?
Small distance. Xiaojian.
Okay.
Small
Which
distance.
nerve branch? Di ba little space?
The small distance.
Little.
A small distance ba?
Xiaojian.
Yeah, small
Yes.
distance.
Yeah, small distance.
Hindi pala space. Which nerve branch supplies the
Pwede din eh. Pwede din siya. Pero small space, not little.
space siya dapat? Not little.
Small
Yeah,
distance
sorry.
or
Small
small
distance.
space.
Number 4, which nerve branch supplies, kaya pala masakit, supplies the Xiaotian point according to the anatomical study?
Radial nerve.
Yes. Ay, yung nasaktan, talagang alam na alam. No? Effective sa knee pain. No? The point Xiaotian lies on which primary meridian channel?
LI.
LI. What is the prohibited practice when needling Xiaotian?
Inserting the needle deeper than 0.5.
Huh? Pero
both hands,
Needle
both
insertion
hands.
on both hands.
Yeah, both hands.
hindi dapat both hands. Masakit na nga both.
Oh, yeah. Oo nga, needle insertion on both hands.
Actually, you can insert deeper kung iba yung indication mo, di ba?
Okay.
Di ba pag hernia,
Oo.
2 to 3
Mas
deep.
malalim.
Mas malalim.
Which of the following conditions is not an indication for Xiaotian?
Liver cirrhosis.
Liver cirrhosis.
So maganda siya for chronic bronchitis, eye pain.
Hernia.
In the manipulation technique, which side selection rule is applied for treating a disease on the left side of the body?
Needle on the right.
Okay, opposite, no? The distance from Tatian to Xiaotian, ito yung first natin, no? Tatian to Xiaotian is best described as, or gaano kayo siya?
1/4 of the span between metacarpal and PIP.
Which of the following meridians is said to have a strong connection with both Tatian and Xiaotian points, despite them not being directly on its line?
Liver.
The case study mentions that the patient's lungs were withering due to chronic disease.
Don't overcharge, darling.
Which organ's deficiency was primarily responsible for the yellow phlegm?
Spleen.
Yes. Which acupuncture point is paired with Xiaotian to cultivate earth so as to generate metal in the case treatment?
Shan Yin Qiao. Spleen 6.
Spleen 6. When measuring the location of Xiaotian, what anatomical landmark is used as the distal reference point?
Datian.
Which of the following statements about the reaction area of Xiaotian is accurate?
It includes lung, heart, and the 6 Fu bowels.
Okay. What depth infant is recommended for needling down to treat the heart organ at Xiaojian? So this must be deep,
Sobrang
deeper siya.
1
One,
uh,
that's 1/10 ng tune.
Okay.
Mhm. In the described case, after switching to needling Xiaojian alone, the patient's phlegm output was reduced to approximately how much?
half a small baby food jar.
Ang dami pa rin. Which of the following vessels supplies the Xiaojian point? Diba?
Dorsal, digital, and palmar arteries from the radial artery.
Mounting qi is indication for Xiaojian. Which condition does this phrase refer to?
Inguinal or femoral hernia.
What is the recommended length of the acupuncture needle for Xiaojian?
0.5.
0.5. Which point is located exactly halfway between the MCP joint and the PIP joint on the index finger?
Dachshund.
Yes. The 6 full bowels mentioned as part of Xiaojian's reaction area correspond to which of the following organ systems?
The 6 hollow organs.
Yeah.
Stomach, LISI, GB, UB, and TB.
In the case study, which point was not used as part of the initial 12-channel treatment to supplement the lungs?
Lung 7.
What is the significance of measuring tooth distal to Tatsien when locating Xiaotian?
It provides a consistent lateral offsets from Daijian.
Hi, Sir Mark.
Hello, Sir
Hello
Mark.
po.
Nagulat ako, parang galing sa
Oo nga eh. May
Natapos ko na
parang
mag-treatment sa
apparition.
kahapon.
parang apparition.
Biglang salit.
Napatigil ako bigla. Sabi ko, ano yun? Parang galing sa sa ibang
Love
planeta.
it.
Lateral offset from Daijian.
Kaya pala tinanong ko anong work ni Madam. Kasi may nakita akong tattoo niya sa may spleen 6. Na-shock ako. Ano to? Bakit may pentagram? Oh, nagpa-practice siya ng witchcraft noon. Buti nagbago na siya. Christian na siya.
Buti na-convert siya.
Na-convert na. Sabi ko, Grace, walang putulin na lang. I really like her. She's very lively.
Mm-mm.
But, okay, sige. 24. Which gender-specific needle side rule is mentioned for Xiaotian?
Right
Right
side for women. Left side
left side for men.
Okay.
Mm-mm.
What
Left
condition
side
does
for
a heavy
women.
feeling in the chest
Left side for
specifically
women.
indicate? Pag
Lung
Chest, lung separation.
suppuration.
yeah, lung suppuration. Ibig sabihin, alam niyo ba ibig sabihin niya? Nagnanana. Which of
May
the following
nanana, Doc.
Which of the following is a correct pairing of point and its primary therapeutic focus as per the case description?
Lung 7, open lungs
Lung
G.
C.
27. The phrase cultivate earth so as to generate metal in the treatment rationale refers to which TCM theory?
5-element
Yeah,
cycle.
generation. Which anatomical structure is not associated with Xiaotian?
It's not. Extensor digitorum brevis.
Memorized? Ay, mag-ano tayo ng anatomy physiology. Siguro dadagdag natin para doktor na kayo.
Extensor digitor.
Yes. The term SIG listed under 1 point indications most likely refers to which symptom?
Abdominal distension.
Which point is described as being used to make space in the lungs for the clear qi to arise?
Gerchi.
LI11.
LI11.
How far above Tatian is Xiaotian measured? Ilang inch?
0.2.
0.2. Which of the following best describes the relationship between Xiaotian and the LI meridian?
LI meridian. It
It
is
is
on
in the
the
B
B
line.
line of the index finger, but not on the main LI channel line.
Okay. Parang sanay na sanay ka gumamit nito, no? Sir Mark.
Yes po, lagi ko ginagamit yan.
Oo. So, hindi naman umiiyak yung pasyente. Masakit.
Pressure plate
May
lang po.
technique siya, di ba? Pressure lang.
Pressure lang.
The reaction area of Xiaotian includes the 6 organs. Which of these is not considered one of those 6 in TCM?
Pericardium.
Which point did the practitioner use to strengthen the spleen?
Spleen 6.
Spleen 6.
Ah.
What is the primary reason for not using the lung channel directly to supplement the lungs?
Spleen
The spleen
was
weak
weak and needed
and needed
strengthening.
certain first.
Which of the following statements about the measurement unit fun is correct?
1 fen equals 1/10
1/10
of a pun.
Yes.
Soon.
A large peanut butter jar as a visual aid. What clinical significance does this analogy serve?
It illustrates the
Yes,
quantity of sputum produced.
Beautiful. Okay. Which point is described as being bisected from Tatian to the anterior proximal interphalangeal skin crease?
Xiaojian.
Yes. Which side of the body is associated with blood when selecting the
Lung.
kneeling side for Xiaotian?
Right side.
Side.
In the case study, which organ's weakness was identified as the primary cause of the patient's chronic yellow
Yellow
phlegm?
Spleen.
Yellow spleen.
Okay. So alam nyo na, lung and spleen, no? What is the clinical implication, paulit-ulit, of a heavy chest feeling?
Lung
Signifies lung suppuration.
Okay.
Yan na ang
Which of the
lungs.
following is a correct depth for needling Xiaotian when treating hernia or knee pain? So mas malalim to.
2 to 2.5 or 3.
Pun.
0.2,
2
0.2,
point 25 pun.
0.25.
Per 2.3 yun eh. 0.2 to 0.3.
Okay.
Soon. Anyway.
Pwede pala yun.
Pwede na.
Mas
Kasi
mahaba.
may choice man na 0.3.
0.3. Oh, dun sa Master
Bakit na rin
2
yun? Sa
website.
Master 2. Okay. Detail? Grabe. Okay. Point Xiaotian is located on which anatomical segment of the index finger?
Middle phalanx. Proximal phalanx.
Proximal phalanx. Which of these points is not on the LI channel but has a strong connection to it?
Long 7.
Lung 7. So connected siya talaga kay LI11. Which of the following best captures the rationale for inserting the needle 0.1 to 0.2 tune for heart diseases at Xiaotian?
To affect the deep cardiac innervation.
The small distance and big distance points. Yung small, okay.
Big
Big yung last. Are collectively part of which meridian's auxiliary line?
Large intestine.
Which of the following correctly identifies the lateral or radial orientation of Xiaotian relative to Tatian?
Radial side.
Radial side. In the treatment protocol, which point was used to drain before switching to Xiaotian alone?
LI po?
11.
LI11.
LI11 ba?
Drink.
Oo nga pala. Sushi. LI11.
Chuchi.
Sushi.
Chuchi.
Parang sushi.
Chuchi.
Ginutom tuloy. The presentation references 6 Fu vowels. Which of the following organs is part of this grouping?
Stomach.
Siyempre, Fu. Which point has its innervation supplied by both Dorsal proper and palmar proper branches of the radial nerve.
Xiaojian.
Which measurement unit corresponds most closely to a modern metric length of
3.
approximately 3 millimeters?
One fan.
One fan.
Okay. The phrase internal externally related to lung meridian suggests Xiaotian has what type of functional relationship?
Secondary
Very.
influence via adjacent meridians.
Wow, congratulations.